Well, the Gauteng Health Department has released unplaced medical graduates from their contractual obligations. A number of funded junior doctors were yet to serve at public health facilities, but the department has made a U-turn, saying they can now seek employment elsewhere without having to pay back the state. Over the months, the South African Medical Association has been threatening to take the government to court regarding this matter, and the union says hospitals are now facing staff shortages. But for more on these developments, we're joined by SONA chairperson, Dr. Mvuyisi Mzukwa, this afternoon. And Doc, thank you so much for your time. Good afternoon to you. The issue around, doctors not being placed, I suppose it's one that hasn't been resolved, especially if we're seeing now that unplaced doctors have been released from their contractual obligations. Just take us through this journey, give us some context, how we found ourselves here.
Good afternoon to you, Dumza, and to your viewers, and thanks for having me in your program. Dumza, what is happening here is that these are doctors who have completed their community service. So these are post-community service doctors who are bursary holders. So now we are getting reports from the Department of Health that they've been released from their contractual obligations. If you have got a bursary, you've got to pay, obviously service the health system for a period of time that you have been getting a bursary from the department. Now, what is happening is that apparently they could not place them because they don't have funded posts. So they had to release them of their contractual obligations, which we find it very problematic. If we look at the state of affairs in terms of health service delivery in the country, where we've got dire shortages of doctors in the country, where we have 0.8 per thousand patients, we don't feel that that is, of any service to the country.
And I just wonder what this then means to the health sector, both for doctors as well as, the hospitals, the clinics, all the healthcare facilities that need the expertise of these doctors, or at least their placements. What does that mean? Because also the worry here, Doc, is that, will we lose these doctors? Will they go private? Will they go to other countries? What's to happen then of the skills that they possess?
Well, in the institutions, you will understand that these doctors were taken out of institutions. So it means there's a further shortage of personnel or of healthcare professionals in those institutions. So that will impact negatively on the service delivery, meaning that there will be long queues, after hours may not be covered adequately, but also on the colleagues on the ground. There's burnout because now instead of covering for one doctor, you will be covering for about 4 absent doctors. So you can imagine the pressure that is on the colleagues that are left behind, but also on the doctors that have left or that are not placed. The problem is that now you are sending those doctors, they have no options. They may go private or they may even go abroad. And we don't understand that. If you listen to the political rhetoric that we always get from politicians when they talk about NHI, they will tell you that the private sector is well staffed, yet they are serving a very small percentage of people and all those rhetorics. But now it is them. If you listen to the statement that was released by the Department of Health in Gauteng, it will tell you that they are sending them out to the private sector. And I don't know what is the meaning of that in terms of what we are looking for the NHI. I'm not understanding why we cannot, do what we promise to the public.
Yeah, I'm also worried, Doc, about, the conversation around NHI, and I'm glad you brought it up because I was hoping the president will also address it during the State of the Nation address. He didn't touch much on the health sector and how the NHI would be implemented in the current state of our healthcare system in the country. What do you make of I don't know, the Department of Health's, promises, the president's promises during SONA in terms of where the country's moving with not only NHI but the system as a whole, which looks to all of us as South Africans as severely strained?
Well, thank you so much for bringing that question. I think we released a statement as the South African Medical Association after the SONA to say we are disappointed by the fact that the president never said anything about healthcare. Yet we know, all of us know, that healthcare is in a disaster. We were hoping that the president is going to come up with plans that are going to address, the disaster that we see, the collapse of the system, in terms of cable theft, in terms of the infrastructure collapse, load shedding that is affecting the shortages in the healthcare sector. But the president never said anything. You will know that it contributes directly to the GDP. So you would want to understand, the president's plan or the country's plan according, how do you make sure that the system talks to what is happening? Everybody knows, that we are in trouble. You've seen the flooding of the hospitals. You've seen fire in the hospitals. You've seen thuggery in the hospitals or in the institutions. So I don't know what else if you don't call that a disaster.
Doc, I also understand that some members have also stated that they do have intentions to emigrate should the NHI be implemented under the current state.
Well, that was a survey that we did. I think it was, if I'm not mistaken, 2019 or 2018, 2019 or so, where we're, trying to get the views of our members regarding the NHI. Well, you'll understand that our members don't really trust, the government, especially on the NHI as it stands. We support the principle of universal health coverage, but South Africa has chosen the NHI, and we have said to the government, we do not, there are things that we are not happy about in terms of the power that is given to the minister, and also how do we participate in terms of the CAPS, and everything else that you pointed out. So those questions have not been answered. So we don't have a way of talking to our members, reassuring them when we actually don't have answers from government. We have called a meeting now to speak to the minister and the deputy minister regarding, the developments around the NHI, because honestly, our members have said, in fact, they have started doing that. If you follow the immigration patterns, doctors are leaving to New Zealand, they are going to UK, they are going to Canada, all these high-income countries, because there is no assurance, of them getting sustainability in the country.
Yeah, I think just also, if I may get your comment on this, while we're speaking about our constrained healthcare system, Dr. Mzukwa, if you may allow me, your comment, please. Dr. Popira Matuba, the MEC of Health, being reprimanded over her conduct by the Health Professions Council of South Africa. And I understand this was also after the EFF's Mvuyisi Mzukwa had laid a complaint calling her utterances to a Zimbabwean patient as xenophobic because she was telling the patient that Zimbabweans are putting a strain on her healthcare system, and I'm assuming as she referred to the Limpopo healthcare system. What do you make of this decision by the Health Professions Council of South Africa?
Well, thank you so much. The South African Medical Association, as an association, we laid a complaint ourselves, to the HPCSA last year in August, where actually we stated clearly that the conduct of the MEC there, who is a doctor, was a disgrace to the profession. It was a disgrace to the profession. We are trained to be compassionate, to show empathy, but that's not what we've seen when the MEC was addressing a patient. We thought that that conduct was unbecoming. It was very unprofessional. So we had to send a complaint there. But we do believe that at least something has been done by the HPCSA, though we feel that, that is a slap in the wrist. When you refer that to the politicians. Politicians, you talk caution and reprimand is nothing to them. They will continue. In fact, we thought that she was using that, to grandstand and to align herself for a bigger political role.
We leave it there, and I appreciate you speaking to me about this. Dr. Mvuyisi Mzukwa, SONA chairperson, thank you so much for sharing your views with me this afternoon. This regarding, of course, the NHI, amongst other things, unplaced doctors right now who are medical student doctors from their contractual obligations. We understand out of a group of 60, most of them are still not placed, and some are releasing that statement about their disappointment that the president did not address the NHI and the constrained healthcare system during his State of the Nation address.